be a solid red.
Oh. We're good?
Yep.
All right. Most people know by now that I worked at the Cleveland Clinic. I spent a good many years working on Team C, cardiac surgery with doctors Sabik and Gilanoff, as well as many other bright and hardworking people at the clinic. One day, we were making rounds at the clinic, and one of my patients was telling Dr. Sabik what a bright young man I was. Dr. Sabik didn't hesitate and looked at him and responded, "He's not that bright. He just surrounds himself with the right people." That statement is true today as it was then. I surround myself with a lot of bright people, and I'm proud to be part of the ACMC healthcare network. Thanks again for Premier Fitness for this opportunity to share some insight on healthcare. During my last Lunch and Learn, we discussed metabolic health and its role in chronic disease. We also discussed healthy aging. What I didn't discuss is what is exactly aging. On a molecular level, scientists have discovered 9 hallmarks of aging. Some of these include stem cell exhaustion, telomere shortening, deregulated nutrient sensing, mitochondrial dysfunction, and cellular senescence.
Okay.
Yeah.
These all contribute to functional decline leading to disease states. Over time, I have gained a greater appreciation for a more functional definition of aging. Frailty, for one, is a very much an important component of declining age. Social components intersect with the biology of aging. What I want people to understand is these functional declines happen in every organ and tissue long before the diagnosis of disease. So much of this functional decline is directly related to the way we are living our lives, which triggers an inflammatory cascade of the fundamentals of mitigating these inflammatory cytokines come down to not a doctor's visit, not a pill, not a magical supplement, but the choices we must make every day. Our exposures, what we are consuming, how much sleep we are getting, how much movement we're getting, the toxins we're exposing ourselves to, our microbiome, and our micronutrient status. These are just some of the hundreds of micro decisions we need to make on a daily basis to maintain our health. So the challenge for the listener is to shift your paradigm from a reactive medical system that benefits from people being and staying sick to one of prevention and health care, not disease care. I don't think I will ever understand aging totally. I don't think any of us will, despite the numerous books that are out and the numerous podcasts. I also believe that we don't really have to understand it fully to be able to make an impact on the biology of aging through interventions. I feel at this point we have a conceptual flavor for what healthy aging looks like, and enough information to come up with a rational approach to target those mechanisms that should have an impact on health and longevity. In 2019, UNSC published a study stating that 88% of Americans are in poor metabolic health. They define metabolic health as having a blood pressure less than 130/80, lipids in the normal range, fasting blood sugars less than 110, and the absence of truncal obesity. To achieve metabolic health, stabilizing blood sugar is the lowest hanging fruit. It is also the cheapest, quickest way of achieving any health goal you have, whether it's to look better, feel better, prevent chronic disease, improve your athletic performance, or just have a proper functioning brain. At my last Lunch and Learn, I mainly focused on diabetes and insulin resistance, its causes and its treatments. If you are interested or need a refresher, it is online at YouTube and just punch in my name. Today I will address one other marker of metabolic health, blood pressure. I will also discuss why you should consider wearing a wearable device, a supplement that most of us are taking right now, and a blood test you may have never heard about but should consider having. I'm often asked, why did I have a heart attack? There's no single one cause. The disease begins in adolescence with the laying down of fatty streaks. A hallmark indication of disease progression is atherosclerosis. If you can slow the development of atherosclerosis, you can protect your heart and brain for years. Smoking, high cholesterol, elevated blood sugars may have the loudest signals as promoting chronic inflammation. Chronically elevated blood pressure increases the risk of damaging the delicate innermost lining of your arterial walls, called the endothelium. And in turn, this kicks off a chronic inflammatory cascade, which leads to further narrowing and stiffening of your arteries, putting you at risk for heart attacks, strokes, kidney disease, and peripheral vascular disease. One of the most common diagnoses in medicine is a diagnosis of essential hypertension. At a conference recently, a speaker asked the audience, "What is essential hypertension?" The audience was silent, because in truth is, the diagnosis of essential hypertension just means that we really don't know what is causing the hypertension. A more appropriate question is it essential that I develop hypertension as I age? Just because our parents had hypertension, does it doom us also? As we discussed earlier, the development of atherosclerosis affects blood pressure. There are many other factors that control blood pressure, and I'll share some simple strategies that may help you. The new guidelines call anything over 120/80 elevated blood pressure. I often show my patients this graph, whereas the risk of having heart attacks, strokes, and kidney disease is pretty marginal if we maintain your blood pressure between 120 and 130. Notice that after 130, there's a steady increase in the development of disease. Below 160, your body is able to self-regulate itself and protect itself from having really high blood pressure. But notice what happens to disease states at 160. The sharp incline of strokes and heart attacks. At 160, 170, the body can no longer auto-regulate itself. So how do we measure our blood pressure? Make sure you're in a calm, quiet environment. Make sure that you're sitting down for 5 to 10 minutes. Elevate your arm to the level of your heart. At first, you should check your blood pressure a couple of times a day, once in the morning, once in the afternoon, for about a week, and record those blood pressures. The device I favor is one that's made by a company called Omron. We find that this company makes a very good product, and the devices are very reliable and very accurate as compared to the devices that we use up at the hospital. One question that I'm often asked, does salt raise your blood pressure? And the prevailing thought is salt raises blood pressure, and most commonly you are told to restrict your salt. But it really isn't the salt amount that makes a difference, but the salt concentration. When you eat salt without water, your serum osmolarity goes up. This stimulates your adrenal gland to secrete a hormone called aldosterone. And you thus hold on to water. The more water you hold on to, the higher your blood pressure will be and the more swelling that you're going to have. One of the most common blood pressure medications is a water pill where you excrete water and sodium at the same time. If you drink water before you eat the salt, you can avoid the rise in serum osmolarity. No rise in serum osmolarity, no stimulation of the adrenal gland, no rise in your blood pressure. I was taught this many years ago by a kidney doctor, a nephrologist by the name of Rick Johnson. The role that sugar plays in hypertension. In the development of hypertension, there are many players. There are the initiators, and then there are the things that make it persistent. Inflammation in the kidney is involved in the persistent. In the initiation, turns out sugar has a major role. In a study in 2013, it showed that when you give a diet high in sodium to someone, it increases serum sodium, which then activates an enzyme that converts glucose to fructose. This fructose is made by the body and not by the diet. This fructose then gets metabolized and raises your blood pressure. This study showed that when you block the metabolism of fructose, you block the rise in blood pressure. We've known for years that uric acid causes gout, but increased uric acid is associated with kidney disease and hypertension. Formation of uric acid is caused by purines. Purines are formed by consuming RNA and DNA, which are in meat, yeast, which is in breads and beer, and sugar, especially fructose. Another way sugar causes hypertension is stimulating the hormone insulin. Insulin, as you recall, is that hormone produced by the pancreas to regulate your blood sugar. An abundance of insulin stimulates the adrenal gland to produce aldosterone. Aldosterone tells the kidney to hold on to sodium. More sodium that you hold on to, the more water is stored. Remember, water always follows sodium. Insulin is known as an anabolic hormone, or a hormone of growth. It promotes growth of cells like fat and blood vessels. The blood vessels don't get longer, they get thicker. As our blood vessels grow, they get thicker like a garden hose. The thicker the vessel, the higher the velocity. The higher the velocity, the more your blood pressure will increase. Insulin also has an effect on nitric oxide. Nitric oxide makes our bodies pliable, our blood vessels pliable, and also cause vasodilation. Think Viagra. The less it can vasodilate, the higher your blood pressure will be. So I'm often asked, Doc, I'm just taking too many medications. What can I do to change? What can I do to get off these medications? I often sit down and I talk to them about lifestyle changes they can make to lower the blood pressure. One of the easiest ways to do is to maintain a healthy weight. In general, for every 20 pounds lost is 10-point reduction in your blood pressure. 10 points is the medication. So for every 20 pounds, you can lose one blood pressure medication. Stay hydrated. It's no coincidence Weight Watchers tell their members to drink 6 to 8 10-ounce glasses of water daily. Staying hydrated blocks the production of aldosterone and the production of your body producing fructose. Go back and watch my first presentation focusing on insulin resistance. As I stated back then, 90% of people with hypertension have either diabetes or insulin resistance. Don't drink fructose or any other sugary drinks. Get your vitamin D levels checked, and we'll talk a little bit more about that later on in this conversation. Get 8,000 steps a day. Monitor your uric acid levels. In general, we want to see uric acid levels less than 5. Women have lower uric acid levels generally than men due to their estrogen production. Limit or avoid alcohol. Eat foods high in arginine, and we talked about that during our first lecture, or consider a supplement of arginine. Consider yoga, meditation as an effort to lower serum cortisol and stress. And if you tried all these and your blood pressure is still elevated, you should consider having a sleep study done. People with obstructive sleep apnea typically have resistant hypertension. So why do I recommend and why do I wear a wearable device? There are many wearables out there, and I'm not here to sell you on any of them. There are watches, bands, and rings, and each one of these have their advantages and disadvantages and have different cost points. I started wearing one roughly 5 years ago after purchasing a new car. I was driving down the street with my wife, and I was noticing all these new bells and whistles in the car and how well the car monitored itself. And I looked at her and I said to her, I said, what are we doing to monitor ourselves? And at that time, we were just taking our blood pressure a couple of times a week. And I started looking and investigating the different products out there and the different cost points. So why do I wear one? What I'm measuring matters to me. 2, what I'm measuring differs from day to day in ways that are not intuitive or linear. 3, what I'm measuring can be measured accurately. 4, I can report the data in a time frame that is relevant to learn from. 5, from this data, I can provide corrective and actionable feedback to myself. One of the things that almost all the wearables have, or all the wearables have, is heart rate. The average resting heart rate is between 40 and 90 beats per minute. Women tend to have higher heartbeats than men. Generally, the slower the better. People with resting heart rates greater than 90 generally have a worse prognosis. If you notice an abnormally high heart rate compared to your baseline, this can be a warning sign of illness, stress, poor sleep, poor recovery, or too much alcohol. Lower heart rate generally represents good cardiovascular health and recovery. Factors that may affect your resting heart rate: nutrition, alcohol, caffeine, certain medications, hydration, level of physical fitness, and activity. There are several factors that you can't control that affect your heart rate. One is illness, age and gender, your hormonal cycles, emotions and stress, and just plain genetics. I always tell people that I have a diesel engine where I have a naturally low heart rate, and some people just naturally have 2-cylinder engines when they have naturally higher heart rates. I'm often asked, what should my exercise pulse rate be? And generally, I tell people don't worry about their exercise pulse rate. It's more important that you feel comfortable while you're exercising. Going back to our first conversation, I recommend my patients do level 2 exercise. So zone 2 exercise is working below your anaerobic threshold. So below the point where the body's producing lactic acid. So you should always feel that you're working out at a moderate level. You should always be able to carry on a conversation. If you can't carry on a conversation while you're exercising, that means that you're above zone 2 and you should probably back down a little bit. 20% of your exercise, if you're capable, should be at zone 5. Zone 5 is where you're working your fast twitch muscle fibers, and in an effort to maintain those. Those are the fastest, your fast twitch muscle fibers are the things that we lose the most as we age. There's something on your watch that I want you to be familiar with, and that's heart rate variability. A healthy heart actually changes its rhythm with each beat. This constant variation in milliseconds between heartbeats is known as your heart rate variability. If you are unaware of these subtle variations, but they reflect your heart's ability to respond to different situations. Heart rate variability can react to stress, illness, before resting heart rate does. One example of this is now COVID. One of the early warning signs is a decrease in your heart rate variability way before it affects your resting heart rate, which could be a warning sign that you are getting ill. Heart rate variability is linked to what we call your autonomic nervous system, and a balance between your parasympathetic, think rest and digest, and your sympathetic nervous system, think fight or flight. A high heart rate variability is associated with rest and digest, fitness, and good recovery. A low heart rate variability is associated with fight or flight, stress, illness, and overtraining. One of the other aspects that I pay attention to on my watch is the number of steps that I get every day. Getting your steps in is very important. Personally, I have a sedentary job, so I need to exercise every day in an effort to get my steps in. I have patients, because of their occupation, the type of work that they do, get many more steps than I do on a daily basis, just in the, not by exercise, but what they do on a daily basis. And a recent 12-year study showed people that averaged less than 4,000 steps per day had more chronic disease and a poorer prognosis. At 8,000 steps, the risk reduction went down by nearly 50%, and at 12,000 steps, risk reduction reduced even further to 62%. Greater than 12,000 steps per day, there was no further benefit. Well, these devices also measure sleep, pulse oximetry, temperature, your running cadence, distance, and some even will give you your heart rhythm. One of the markers of aging is frailty. Frailty is a component of aging. Let's talk about an epidemic that no one's talking about. From 2007 to 2019, we've seen an increase of over 30% in fall-related deaths. That's 7 fall-related deaths every hour. That's more than COVID for that age group. In adults greater than 65, it is the 6th leading cause of death, just below sepsis. Some speculated causes of this increase are longer survival rates after developing common diseases, higher rates of Alzheimer's disease, higher rates of diabetes leading to neuropathies and obesity. As far as Alzheimer's disease, it's always one of those things, was it the chicken or the egg? And the fact that the frailty caused Alzheimer's disease, or did the Alzheimer's disease cause the frailty? I'm going to say a word that should scare you to death. No, the word is not toxic megacolon. It is sarcopenia. Sarcopenia is a term that we use to refer to loss of muscle mass as we age. Sarcopenia is one of the most inevitable aspects of aging. I personally consider it probably the worst gravity of aging. As a result of aging, we're seeing more low-grade inflammation, more oxidative stress, impaired regenerative capacity, impaired muscle protein synthesis. We have two very simple ways of measuring functional deficits. Two simple ways of measuring frailty. The first simple method is grip strength, and this is just by a grip caliper. And most physical therapy offices carry this. So we're looking, the cutoff points for men is less than 27 kilograms, and for women it is 16 kilograms. Another simple test, and people can do this in their own homes, is chair to stand test. And the cutoff for this is you want to be able to get up out of the chair 5 times in less than 15 seconds. So you're measuring just how to sit to stand. Hands are either fully in front of you or cross your shoulders. You get someone with a stopwatch, and then you just measure how they sit and stand. And you do this as fast as you can. Just these 2 simple tests tell us a lot. Several studies have shown a 5-year mortality risk of over 60% for those that have low grip strength and low sit-to-stand scores. Let's face it, if you want to be a highly functional 65 or 70-year-old, you can't afford to be below average or average at age 45 or 55. A recent study by Kim et al., published in 2018, looked at a group of individuals between the ages of 50 and 65. And they compared them to the average American control group. They took these people with a functional capacity of somewhere between 4 to 5 METs, which is the ability to climb a flight of stairs without shortness of breath. And they trained them to the point 2 to 3 days a week, so no intensive training, and they got a 25% increase. So they went from 4 METs to 6 METs. In that simple improvement in their functional capacity, they, over a 10-year period of time, had a 34% reduction in risk in strokes and heart attacks and mortality. If they achieved more of a benefit than that, their risk reduction went down to 47%. These data points are all well and good, but they don't speak to the quality of life, and that's what matters the most. None of this speaks to, can you get down on the floor and play with your grandkids? Can you perform the activities that bring you joy? Can you still enjoy the quality of life in your 60s and 70s and 80s that you had in your 40s and 50s? I think the more of these things that you want to enjoy later on in life, the more that you want to be in a higher group of both strength and cardiorespiratory fitness. My wife doesn't like when I talk about blood work, but I'm a big blood work guy. Anybody that knows me, blood work doesn't lie. There's a blood work, there's a blood test that I do that I find is just as important as measuring your hemoglobin A1C or measuring your cholesterol. And I want to share this with you. As I brought up before, your cells are made up of phospholipids, fats. The healthier the fat that you consume, the healthier your cells are going to be. The healthier cells, the healthier that you're going to be. In 2004, the physician healthcare studies show that people that consume 2 to 3 servings of fatty fish per week had a 20% reduction in sudden cardiac death. The Framingham data was a cohort study that's still ongoing, that's studying the town of Framingham, Massachusetts. A gentleman took blood samples that were 20 years in the making, and he looked at the omega-3 content of that blood. People that had omega-3 indices greater than 5 had a 30% reduction in the cardiovascular events over a 20-year period of time. In the medical world, there have been several recent studies with mixed reviews. Some of the most recent studies were the VITAL study, which used 1 Luvasa tablet in a group of 65 to 80-year-olds with no reduction in incidence of MIs or CVAs, but there was a risk reduction in overall mortality. I thought that was quite impressive because when you looked at that group of people, you're talking about 65 to 80-year-old individuals that are following the standard American diet. You gave them 1 fish oil tablet and you studied them for 10 years, and they had a reduction in their overall mortality. So what happens if we hit them with a bigger hammer? So several years ago, Harvard Medical, Dr. Bott, came out with the Reduce It study, and he gave them 4 Vasipa tablets. So Vasipa is a prescription drug. Most fish oil contains both EPA and DHA. This drug is strictly just EPA. In the body, taking just EPA, some of this will eventually get converted to DHA. This study was pretty impressive. So it looked at people 65 to 80-year-olds. Most of them previously have had a heart attack. So they were, at this point, already taking a statin. They had reduction in heart attacks and strokes over a 5-year period of time. Pretty impressive. Then last year, the strength study came out, and this was published by Dr. Nissen at the Cleveland Clinic. And it used a combination of both EPA and DHA. Their product that they used a type of EPA and DHA that you did not need to consume with food. Typically, when you take these products, because they're in ethyl ester form, they need to be consumed with food for them to be totally broken down. This study came out, and it was a little bit disappointing in the fact that it was actually terminated early because it had no risk reduction to it. And then most recently, several months ago, a gentleman by the name of Bill Harris, who's been studying EPA and DHA for many years now, put out a 17-site cohort group. And it looked at 35,000 people. And over a 10-year period of time, these people, they either supplemented their diet or gave them fatty fish and raised their omega index to greater than 8. This study was quite impressive, and it showed that a 15% risk reduction over a 10-year period of time in all-cause mortality. When I say all-cause mortality, I'm talking about cardiovascular, I'm talking about cancers, and I'm talking about accidents. The average American has an omega-3 index level of less than 3. The average Japanese, with a 5-year greater life expectancy despite more smoking, more hypertension, has an omega-3 index of over 9. The average vegetarian has a omega-3 index of 1.5. A dolphin who consumes just fatty fish has an omega-3 index of 17. There are two major centers for Alzheimer's prevention in the United States. One by a gentleman by the name of Dr. Dale Bredesen, who wrote the book The End of Alzheimer's Disease, and the other by Richard Isaacson out of Cornell. And both of these gentlemen use high-dose omega-3 fatty acids as part of their prevention strategy for prevention of Alzheimer's disease. So how do we get our omega-3 index higher? Either through the consumption of fatty fish like sardines, tuna, mackerel, anchovies, or by supplementation. Fish oil is in an ethyl ester form, and it needs to be consumed with food. Better absorption is with fish oil in the triglyceride forms, and this is what I used to recommend to my patients, but it's much more expensive. Krill oil, I'm often asked about, is more absorbable than fish oil, but the problem is that krill oil contains much less EPA and DHA. It is high in a compound called astaxanthin, which is a very potent anti-inflammatory, antioxidant. Another reason to take fish oil supplementations is a study of older adults between the ages of 45 and 60 that showed better uptake of amino acids in the muscle in people consuming omega-3 fatty acids. So the bottom line is, I feel it very important that you get your omega index level taken and tell you where you're at as a starting point. The goal for risk reduction should be a level greater than 8. And it generally takes 2 to 3 months for your body to ramp up that fatty acid level. Lastly, I'd like to talk about a supplement that has sort of taken off with the incidence of COVID. Many know that living in northeastern Ohio, we don't get enough sunlight or vitamin D. Vitamin D is essential for reducing inflammation, blood sugar control, bone and teeth health, our immune systems, production of our hormones such as testosterone, estrogen, and serotonin. And it also helps control our blood pressure, believe it or not. The most absorbable are oil-based gel caps or liquids. Only take D3 form, cholecalciferol. This is the human form. D2, which is by prescription, is non-human. It's less effective, and it does not yield the same results as taking D3. So how much should I take? And there's mixed reviews out there. We're all different, and we all absorb it differently. The more body fat that you have, the more vitamin D you'll need to take. Fat acts as a sink for vitamin D. So what is a good level? When we measure the blood, we measure the precursor, 25-hydroxy vitamin D. The levels of 30 to 80 are adequate levels. The sweet spot is between 40 and 60. I reviewed over 30 studies. And in between 40 and 60, we get all the benefits of vitamin D with less risk. Also, within this 40 to 60 level, it's associated with lengthening our telomeres. Remember, telomeres are one of the markers for aging. In general, it takes 1,000 international units to raise your vitamin D level 5 points. So as a starting point for my patients, if they're male, I tell them to start off with 5,000 international units daily, and then within 2 months, I will measure a vitamin D level. For women, I generally tell them to start off at 4,000 international units daily. And again, we'll measure their levels in a couple months. What happens if I take too much vitamin D? Well, it can raise your blood calcium. Vitamin D helps the body absorb calcium. If your vitamin D level is low, calcium absorption is poor. Getting levels checked several times a year is very important. Too much calcium in your blood can lead to several diseases like atherosclerosis and developing kidney stones. So what about COVID and vitamin D? Although there have been no randomized control studies, there is enough evidence that suggests that people with adequate vitamin D levels have improved prognosis when they get COVID. Although, when you look at some of the studies that have been taken, when you look at an acute care situation, people that had previously not taken the supplement and they were given high doses of vitamin D did little to improve their prognosis. So in general, you want to ramp up your levels now before we get hit with the long, cold winter. The relationship between disease and biology of aging is very underappreciated. People continuously debate whether the biology of aging causes disease like Alzheimer's disease, cancers, and cardiovascular disease. The point is to find the most effective way of preventing diseases and keeping people healthier longer. For the past week, I've been thinking about this statement. You are what you do, not what you say, not what you think or believe, but what you spend your time on. In today's age, so many of the health behaviors are driven by trying to copy the action of others. I'm a big believer in people finding their own blueprint for success. I want people to envision the life that they want to lead and the behaviors that work for them. I hope my Lunch and Learns will give them some insight into a blueprint that fits into their everyday lives. Thank you for your time.